Good afternoon, everyone. Kaylin, can you hear me okay?
Yep, we can hear you great. Thanks.
Excellent. Well, good afternoon and good morning for those not on the East Coast. My name is Jeff Locke. I'm the Program Director for Public Safety and Legal Counsel at the National Governors Association. Thank you for joining us for this webinar today on expanding access to medications for opioid use disorder in corrections and community settings. Before we get started, I've got a few housekeeping items here just wanted to touch on. First, this meeting is set up as a webinar. I know we're doing a lot of Zoom calls these days, but there'll be no need to mute or unmute yourself. If you have a question or comment during the Q&A portion of the webinar, please feel free to write it into the chat box using the Q&A feature on Zoom, or use the raise hand feature and we'll get to you. We hope this will be a pretty interactive event, so we welcome your thoughts and hope you get in on the conversation. Second, if you have not received this roadmap that we'll be discussing today, please note that the roadmap is available on both the NGA and ACA respective websites. For NGA, you can find it by navigating to nga.org and then opening the NGA Center menu and selecting publications. We're also putting it into the chat box here for easier access. Third, this is a public webinar and we're considering this open press. We'll be recording this webinar and posting it to YouTube later this week. We're happy to distribute that link if it's of interest. And obviously the occasion for today is the release of our roadmap on expanding access to MOUD in corrections and community settings, which is jointly authored by the National Governors Association and the American Correctional Association. Our hope is to find with this report and talking through our webinar today, some opportunities and challenges that we can highlight for governors' offices and senior state officials to consider as you move forward in your respective states. Just a couple quick thank yous from me before we get going. I want to start by thanking governors' offices and senior state officials and corrections for sharing your perspectives around your respective programs and policies in your states and your jurisdictions and the importance of this work for you and your governors. Additionally, I want to thank the leadership here at NGA for their support to this work and to the roadmap itself, including our Executive Director, Bill McBride, and Center Director, Tim Blute, and the rest of the leadership team who I believe are on this afternoon. We also want to thank our partners at the Centers for Disease Control and Prevention for their generous support of this work. Our partnership with CDC on opioid and drug challenges is going on over a decade now. We cannot do this work without their thought partnership and support from them and our wonderful colleagues there over at CDC, starting with Rita Noonan and Jessica Wolf. So I want to thank them both on behalf of NGA for their support and partnership throughout the life tenure of our work together. And of course, without the ACA, this report absolutely cannot happen. The report over there is led by Dr. Gondels, who's going to speak in a moment, and the roadmap is a culmination of years of our partnership together on MOUD and corrections, their leadership in their respective space. And we're grateful to continue this partnership on this topic with so many of our guests here this afternoon. And I have to say, over the last decade of this partnership with CDC, several years ago, CDC and NGA started to move into how we could support special or more vulnerable populations dealing with overdoses. And we lasered in on justice-involved individuals as a particular group of folks to focus in on. And it's with that lens that our partnership with the ACA has taken hold. And we're very thankful and appreciative of their support and partnership along the way. So before we get into our discussion, I want to turn it over to our partners at the ACA and then CDC for their welcoming remarks. Dr. Gondels?
Thank you, Jeff, and greetings, everyone. We want to thank you all for being here today to join us as we launch the roadmap, expanding access to medications for opioid use disorders in corrections and community settings. But before I say a few words on the roadmap, on behalf of our 107th President of the American Correctional Association, Commissioner Tony Parker of Tennessee, and Executive Director Jim Gondels, we are so excited for this moment. I would like to introduce the American Correctional Association's Office of Correctional Health's Director. His name is Mike Miskell, who is the Director of the Office of Correctional Health. And along with myself, I'm Dr. Elizabeth Gondels, Senior Director of the Office of Correctional Health, Professional Development, and the Office of International Initiatives. ACA and the National Governors Association are very excited about the launch of this roadmap and the publication, as Jeff pointed out, it is a accumulation of several years of joint work by NGA and ACA, and many of you on this line who have participated in making this happen. We thank you. We are so pleased to be able to continue this important work with the National Governors Association in 2021. We also echo NGA's words that we are extremely appreciative to the Centers for Disease Control and Prevention, with a special thank you to Rita Noonan and Jessica Wolf for all their support. You guys recognized early, in order to reduce overdose deaths in the United States, correctional facilities across the nation would need to play a critical role in this effort. Thank you. Over the last 6 years, the American Correctional Association has been at the forefront of addressing this critical public crisis affecting the justice-involved population. Several years ago, we called on corrections to develop and implement an integrated treatment program for opioid use disorders. After several years of work on educating corrections field on the importance of medications for opioid use disorders, ACA passed a resolution on OUD in January of 2017. And in January 2018, the resolution became public policy. Its last revision was in January 2020 at our winter conference in San Diego. This public policy is available and can be found on the ACA website. This policy supports the use of evidence-based practices for the treatment of opioid use disorders. ACA has developed recommendations specific to the needs of correctional policymakers and healthcare professionals. These recommendations will enable correctional administrators and others, such as jails and prisons and community corrections, to provide evidence-based care to those in their custody or under their supervision that have this disease. With that said, we believe the roadmap will be an excellent guideline for your governors, corrections administrators, and sheriffs to expand or start opioid use disorders programs, treatment programs, in correctional facilities and in community corrections. ACA and NGA will continue this strong partnership by working closely together, assisting states, officials in addressing this national epidemic. Now I'd like to turn it back to Jeff.
Great. Thank you, Betty. And with that, I invite our partners, Jessica Wolf, for her thoughts and for CDC's perspective.
Thanks so much, Jeff. We are just so thrilled to see this resource come to fruition and so happy that so many of you are able to join us this afternoon. This was an idea that we had at CDC a couple of years ago, or maybe it's been even longer than that at this point, but NGA and ACA were really just the perfect partners to execute this work. I can't thank them enough. Betty and Jeff and Kaylin and everyone else at NGA and ACA who just contributed so much time and energy and expertise into creating this resource. Want to also echo what Jeff said and just give a huge thank you to all of the state partners who participated in the MAT and corrections workshops that NGA and ACA hosted. The barriers and challenges and successes that were discussed during those workshops really drove the content of this roadmap and helped us know kind of if we were on the right track in terms of the direction we were headed with the document. So many of those state partners also reviewed the roadmap and provided really critical input during its development. So thank you so much to those partners as well. I think this is going to be a tremendous resource to the field and really just look forward to disseminating this broadly. I think the information is critical, perhaps now more than ever, as we know COVID-19 is creating greater challenges for incarcerated individuals, and in particular, those with substance use disorder. So I know we have a lot to cover in just an hour, and I don't want to hold this up anymore, so I'll turn it back over to NGA. I think we're going to walk through roadmap at this point. So thank you.
Great. Thank you, Jessica. Thank you, Betty. Next slide, please. You know, we're obviously looking forward to presenting to you all this roadmap today. We hope it can be used in your respective jurisdictions, particularly by governor's offices and senior state officials in corrections and otherwise, because for individuals with OUD, providing medication-assisted treatment or Medicaid opioid use disorder treatment inside correctional facilities and in doing so, ensuring continued access to these medications upon reentry has been studied. And it's been shown the impact in your states on key issues such as overdose deaths, recidivism, and opioid use post-incarceration. And while I think there was a couple years here where we thought we were making progress nationally around overdose deaths, we've all seen, unfortunately, the more recent official and unofficial data on overdoses, which frankly suggests there's a lot more work left to be done by all of us, particularly among how do we reach those who may face challenges in procuring access to community-based services, which starts with, at the very minimum, justice-involved populations. So with this roadmap, as well as a continuing workshop series with states, NGA and ACA are working to help governors, senior correctional officials, and their respective staffs develop and implement strategies to both strengthen public safety, but also bolster these partnerships between safety and health officials across the continuum, and in so doing, reduce overdose deaths. So I will conclude as to why now, because I want to signal that this work will continue. And so thanks to our partners at CDC and ACA, we're going to continue to work in this area. It's a key challenge for public health, for behavioral health services, to provide services to justice-involved individuals. We're going to continue down this road together to focus on how governors and corrections agencies can improve not only providing services behind the walls, providing services upon reentry, but how do you improve community supervision efforts and access to behavioral health services? So watch for that in the coming weeks and months. So with that, I'll turn it back to Betty, and then we'll unveil the roadmap.
Thank you, Jeff. So, like Jeff says, we ask ourselves, why now the roadmap? Because education is so crucial to all involved, all stakeholders. This is critical in having an effective OUD treatment program. This roadmap is an excellent source, an excellent resource of information to assist states in reducing OUD in the justice-involved population. It is a roadmap that unifies all of us and how to expand medications for opioid use disorders and together for the justice-involved population. And let me give you an example. On page 9 of the roadmap, we discuss compounding challenges in correctional agencies with increases in opioid deaths. Several challenges in the states that are facing are the resurgence of stimulant drugs, fentanyl, and polysubstances use like methamphetamine and cocaine. And now in the last year, states are facing new challenges brought on by COVID-19. The impact of the pandemic and the opioid use crisis in early data showing has caused injury and in sometimes death of an individual that has opioid use disorders. In this roadmap, we discuss these critical challenges. We also point out the importance of a multidisciplinary service team approach in developing exemplary practices, effective policies, funding of programs, evaluation of individuals, implementation of a program, and treatment of patients with this disease. This is critical for patient outcomes. When I say multidisciplinary service and treatment teams, this includes each and every one of you, our governors, their staff, senior correctional officials, and their staff together developing the strategies to strengthen public safety and public health partnerships to address this epidemic and to reduce overdose deaths. In corrections, an MDST team is the correctional administrator, it's the warden, it's the unit manager, it's the supervisor, it's the correctional officer, it's the community corrections officer in the field. It's nurses, it's doctors, it's our behavioral health specialists, as well as our community partners. These people are critical to implementing these programs. We cannot say enough about the MDST model and its approach. If we have everyone on the same page, working together to save lives from this disease, we cannot fail in gaining support and increasing treatment in the justice-involved population. This roadmap outlines this. We have come such a long way in the last several years in corrections, and through education and implementing OUD treatment programs in corrections, we have saved lives. This has paid off more and more as we are seeing our jails and prisons and community corrections implementing medications for opioid use disorders. With that said, I would like to now turn it over to Kaylin to kick off the overview of the roadmap.
Great, thanks so much, Betty. Next slide. Good afternoon, everyone. My name is Kaylin Hill, and I'm a Senior Policy Analyst at the National Governors Association. We're going to go ahead and dive into give you a brief overview of the roadmap. And just for this portion, I'll be joined again with Dr. Gondels and Mike Miskell from ACA. So we're just going to highlight some of the lessons learned from the states that are included in this roadmap and walk through how we hope this roadmap can be useful to you in your states and in your efforts. Next slide. So first, what is a roadmap? So at NGA and by extension ACA and CDC, we review roadmaps as a policy document development tool for governor's offices and senior state officials to use as a playbook for developing policies and initiatives within your own states. We've had these documents in partnership with CDC become almost like a checklist or literally a plan for governor's offices on policymaking with past roadmaps. These roadmaps are designed as an inventory of key strategies for governor's offices and state officials to implement or evaluate existing policymaking and implementation efforts in the states. For this specific roadmap, we seek to provide a step-by-step guide for governors, correctional leaders, and other state officials who are pursuing initiatives to address opioid use disorder among individuals in the justice system. So another way of thinking about it is that as a way for governors, staff, and state officials to use this as a menu of policy options or strategies to think about informing your own unique state approach to either piloting MOUD efforts or scaling up existing efforts that you all may have. And we truly appreciate and thank all the many state experts and practitioners that we consulted and gathered information from throughout the development of this document. Throughout the document, you'll find highlighted a number of state actionable examples, real examples from states and how they're working across their own systems and working with local jurisdictions. So we hope that you find those helpful as guides as you are working through your efforts. Now I'm going to pass it back to Dr. Gondels just to go through some of the key considerations that we highlight as well. Nope, Dr. Gondels.
Okay. We highlighted up front and throughout the roadmap 10 key considerations as a quick reference guide of major things for state leaders to consider as you are developing and implementing your programs. In correctional facilities, we have to be cognizant of several different considerations. And these considerations include, but not limited to, and as you can see, the 10 outlined here, is access to evidence-based medications is a priority. Medication should not be delayed in the absence of counseling or behavioral support. And that is between the doctor, obviously, that is doing the assessments and starting the patient on medications immediately. Fully implementing evidence-based medications require making multiple forms of medication available and throughout thoughtful consideration. We definitely need to make sure that the treatment plans that we are following, that we look at all the medications and consider the best medication for that individual. Collaboration among the justice system and health systems at every touch point of the justice system ensures access and continuity of treatment. And strategic use, alignment, and braiding of these states and federal funds is key to ongoing stability and success of the program and initiatives. But these key consideration in developing and looking at the roadmap, there is so much details in the roadmap. Please be sure to look at each one of these 10 considerations. Thank you.
And then I can go ahead and take the next slide. So here you see a list of the main barriers identified to implementing an MOUD program within corrections, and it's in no particular order. These are areas we wanted to make sure were addressed within the roadmap document. The way that healthcare is delivered within a correctional setting is very unique. While correctional health is public health, no two correctional systems deliver healthcare and treatment services exactly alike. So that can lead to struggles with identifying individuals with substance use disorders and maintaining continuity of care. Struggles with contracting treatment providers and finding post-release treatment options can also disrupt continuity of care. The drug prices of certain medications and securing the funding to make these programs sustainable are also common barriers. There's also a lot of concern about medication diversion and how to effectively implement policies, procedures, and processes to help mitigate those occurrences. And that can also lead to the top one, lower levels of buy-in from a security perspective. But that top item isn't just unique to security staff. We've found that there's plenty of treatment providers in correctional agencies and the communities that need to be educated on the importance of these medications to increase buy-in from them as well. So these common barriers helped identify different solutions for the roadmap document itself. Next slide, please. Also, many of these solutions came from information we learned from states throughout the development of the roadmap. The document itself, like Kaylin said, contains many examples from states related to what's working for them, whether it's Medicaid processes or how states have formed multi-department committees to help implement programs in corrections. This roadmap is chock full of input from states. We also received great feedback during the regional workshops with the 14 states that were conducted over the past 2 years. Now, most of them were at different stages of their implementation plan or the numbers of medications they were providing. But what those workshops taught us is that the answers are there. This can happen. It's just up to you, your various branches of government, and the other key stakeholders to identify where those resources are located and how agencies can align what they're doing to help benefit one another. A lot of education has to take place along the way, but the roadmap lays out the importance of communicating with the right groups to find out who can help answer the questions to eliminate those barriers. And now Kaylin's going to start with the major themes that are found throughout the roadmap itself. Kaylin?
Great, thanks, Mike. Yeah, so as Mike mentioned, we've seen over the last number of years, many states and communities making strides and seeking to work across criminal justice and health systems to address the opioid epidemic and its impact on people in the justice system. As we were talking to a number of states, both through the regional workshops and then through a number of the states and experts that we've consulted, we've seen that success in these efforts can be achieved by bringing together the key entities and officials that intersect on these issues. So that includes corrections, community corrections and reentry, public health, behavioral health, Medicaid, and other health and criminal justice system actors within your states. So these actors, must be brought to the table to create comprehensive MOUD policies and have sustained effects. In our discussions too with governor's offices and correctional officials, states identified success in a number of ways, but we pulled out some of the key themes and how the states are defining success. So that's providing MOUD and quality medical treatment during incarceration, ensuring successful reentry with warm handoffs, reducing recidivism, decreasing overdose and hospitalizations, decreasing infectious disease, and increasing connections to care and services. So when keeping that in mind as kind of the guiding post, the structure of the roadmap follows the general policy making process towards achieving that success. So first, gathering the key players and stakeholders in the effort, developing an action plan, building capacity, and implementing and evaluating. So we'll just walk through each of those sections briefly, and I'll turn it back to Dr. Gondels to talk about key players.
I can actually talk about the key players real quick, Kaylin. So yeah, that is a crucial first step. Gathering the key players is critical to success. And it could be any number of people in various roles, and it may look a little bit different for each state, but the document helps identify those people that you would want to have on as a core team. You can use existing frameworks to help, and inclusion of different roles within corrections is definitely critical to help get ideas of who else your key players will need to be. Putting that strong core team together is going to greatly benefit your state. Then along the way, there may be additional stakeholders that your core team and other key players identify to help inform and deliver on the program implementation. Kaylin?
Yeah, and then so for next slide, so the next policy in the policy development process is obviously developing an action plan. And state officials can develop comprehensive and evidence informed approaches to reducing overdose deaths and improve outcomes and promote equity for justice-involved people with OUD by developing policies, resources, workflows, and by gaining stakeholder buy-in, as we just discussed. But this includes gathering those key players to develop a plan towards developing and implementing all of those different pieces. So developing a plan includes conducting an environmental scan of existing programs and policies, whether there are existing pilots within some of your facilities or ones that may exist at the local level across the states that you can leverage. And then identifying gaps and opportunities, where may some of the challenges lie and what may be needed or can help to bring your efforts together. Determining information and data needs, and that can be a really key point, particularly within the reentry and transition from the correctional facilities back into the community. Determining information, I just noted information, and finally setting goals. So setting goals at the state level can really serve as a guiding post, for all of your efforts and for developing kind of those intermediate steps towards standing up your programs.
Next slide, please. So building capacity is a huge part in preparing for implementation. You have to make sure that you're able to execute your action plan. So having everything available for successful implementation is key. This means making sure that there's a lot of training that needs to be done on the front end to help reduce stigma, but it also means making sure that there's enough licensed and credentialed providers available to support the program. There's also a lot of information in the document about funding resources that can be tapped into to help support these programs to help build capacity. Building capacity also means making sure that any agreements, contracts, or MOUs, or whatever it is that's needed are in place before implementation. This roadmap is great because it gives you all these different ideas that you're going to want to consider, and there's these easy to use checklists throughout the document itself as well. Next slide, please. So finally, the implementation and evaluation phase is the last element to the success that is identified in the roadmap. Now, whether laws have to be enacted or executive orders issued or whatever it is that has to take place, the support has got to be there to get started. Many states have found that outreach and inclusion of local detention facilities is extremely beneficial, which makes sense since that's where confinement begins. why not continue treatment from the community or initiate treatment as soon as possible? So it's important that our jails and our local detention facilities know the critical role that they play as well. Starting with pilot sites for implementation is common practice, and it can help work out any kinks before moving towards the full implementation. Pilots offer a perfect opportunity to evaluate successes and failures. But we all know you've got to continually evaluate all of the programs from as many aspects as you possibly can. This roadmap gives an range of ideas for process, outcome, and impact data that's going to help increase sustainability of these programs. So let's finish out the presentation with just talking briefly about how all of this has changed during a pandemic. Dr. Gondels?
Thank you very much, Mike. If you remember early on in my comments, I talked about the challenges that we have faced over the past year, and these ongoing challenges considering COVID-19 pandemic. These challenges have been particularly felt within correctional facilities, where according to certain studies, the case rate for individuals in early on were high, and it was 5 times higher than the general population. Additionally, developing and implementing new initiatives or scaling up initiatives in the midst of a global pandemic may have seemed overwhelming. They were very overwhelming. There are trade-offs on capacity, implementation, and resources. And it wasn't so much that the incarcerated people had COVID, but we had a lot of challenges with our staff bringing in COVID. And that's where the struggle and the resources had to be obviously redirected. But we have been encouraged by the efforts taken on by states. States have done a phenomenal job, and a number of whom we are working with through our workshop series that have continued to make some great strides. And listening in and working with the different states, we're so impressed with the time and dedication that they have put towards their programs, particularly facing the challenges with COVID-19. So recognizing these challenges that existed prior to COVID-19 pandemic, and those challenges and barriers may only be heightened and compounded with the new and ever developing challenges that a pandemic present. We also wanted to highlight some additional considerations for implementing these programs during these challenging times. So when you look at state leaders and what they want to consider, and making changes to treatment protocols for inside facilities, looking at what best works for your programs during a pandemic. Considering access and availability of support for potential early releases. We've seen some systems across the country been able to make some early releases. And we've considered potential for shortened release time periods and continue reentry planning and coordination. There's no doubt this has been a year of many, many challenges in corrections as well as in the community.
Great, thank you so much. So that just kind of concludes our general brief overview of the document. I just wanted to provide some highlights of what we've included, and really want to emphasize, all of the great state examples that we've also tried to include that we hope that you all take a look at. But now we'll open the floor to Q&A and discussion. So we'll try to start with state officials first. And I know that we've already had a number of questions come in through the chat. If you have a question, please, or a comment, please feel free to include that in the chat box during this session. We've also gotten a number of folks submitted questions in advance when they registered. So we're going to start off with some of those first and then kind of work our way through, and hope that we'll be able to get through a number of them, although I know that we don't have too much time, so we'll try to work our way through. So the first question that we received was, how can we help our justice systems in areas where there are where there's low community MOUD capacity for reentry? And I know that my colleagues at ACA may have some thoughts on this too, but I think this is a really great question, as a number of states and local communities face challenges in capacity of treatment in communities. We've heard some states, trying innovative and new practices, and increasing use of telehealth to try to improve access in certain situations, and also tried kind of co-locating treatment services with probation and parole to try to provide kind of a one-stop shop and expanding community treatment options. But this is also, a good point to highlight the importance of partnership and strengthening partnerships between corrections and health and behavioral health systems, and leveraging Medicaid and other funding options to incentivize increased access to treatment options and wraparound supports and care coordination. But know that this is a really great challenge. I don't know if Betty or Mike, if you all have anything to add, or Jeff.
Yeah,
oh, go ahead,
Mike. Go ahead.
Doing a careful inventory of community providers is pretty critical as well, because there might be some community resources that the justice system just doesn't realize is out there. And to that end, the choice of the medication is going to be determined by the capacity in the community as well.
Great. Did you want to add to that, Betty? Or?
No, I think we touched a lot on that, doing that inventory of what's available in the community is critical.
And the next question that we got was, how do you get the MAT in jails, particularly in states where there may be hesitancy or resistance with reference to community settings? Does this roadmap address prisons, jails, and community corrections, parole or probation, and MOUD? I don't know, Mike and Betty, if you all wanted to tackle that first.
Well, goes back to my initial comments, education. Education is key, and good communication. Find community organizations who are supportive of MAT, and ask them to meet with your agency, your sheriffs. There may be individuals and their families and communities who've had personal experiences with MAT. And usually you see that's how a lot of times when people get involved is when they have been touched personally with a family member. So I think education is the key, and reaching out and continually to reach out to the community. Mike?
Great point.
Yeah, and then kind of going back to the capacity, making sure that local detention and these sheriffs know where the resources are available. Each state has a state opioid treatment authority that can help identify buprenorphine and methadone providers. The Vermont hub and spoke system, I'm sure many of you have heard of, is pretty remarkable for enhancing community-based MOUD access. So make sure that your local detention and sheriffs and jails are aware of all that as well.
Also, I would like to add also to that is, you can also to support and to change people's minds, we can gather data for your county on subjects such as the number of overdose deaths for those releasing from jail. So some of the things that I think when you do these reach out, you come prepared and to educate the folks that you're trying to bring on board.
That's a great point. The next question that we received from participants when they registered was, how do we create and fund sustainable MAT, allow transitional housing for those reentering so they are set up to succeed? And that's another really great question. I know that we've talked a lot with states about braiding funding, health, Medicaid, community corrections, and housing resources to support kind of funding streams. For example, we've seen some examples of states that used Medicaid state plan amendments to create a housing stabilization services program to support individuals with disabilities, including mental illness and substance use, who are transitioning from institutions, including corrections institutions, and those who are at risk of homelessness. We've also seen states that have developed initiatives to link individuals leaving incarceration with supportive housing upon release, and can reduce the probability of rearrest at the 1-year follow-up. So those are actually a couple of examples that we've highlighted in the roadmap as well. But not sure you guys have other thoughts to that.
Well, the best and most effective option for this might be meet with people who operate transitional housing programs in your community, and who operate these programs. And a lot of some of these people already take on people that are reentering into the community, and they work with them. So adding on Matt, somebody that has opioid use disorders, may not be a challenge for them. A lot of these people already currently have chronic illnesses like hypertension and diabetes. So these facilities generally accept those patients that have medical issues. So a jump to providing buprenorphine, for example, should not be so difficult. So once again, look at who currently that you transition people out when you're doing discharge planning in a jail and a prison that we do now, and qualify that and reach out to them and see if they will take our patients.
Yeah, that's a great point. And we got another question that's kind of along those lines too, with what are the different ways which we can continue the treatment plan for people who are released from the facility back into the community. And I think to your point, Betty, really, bringing together those partners and developing reentry plans and transitional plans, and really kind of ensuring that those partnerships are aligned, so that you're able to connect individuals to services and come up with a plan that's individualized for each patient.
Yeah, when you're contracting that transitional housing, you should include language in those contracts that require MOUD treatment.
That's a good point. But in many rural areas, when you look across the country, we find challenges with folks that operate these transitional centers. So some of the other things that you can work with, other groups that you can work is even your outpatient centers at your hospitals. Who do they refer people out for rehabilitation? Also your public health systems, and looking at and working with your local public health systems. It still remains a challenge. In our more rural areas.
Then we got a question around evaluation, just asking what types of data are being collected to evaluate these programs and processes. And we touch on this a bit in the roadmap to highlight some of the different data sets and information that states and folks can gather to evaluate the efficacy and the success of their programs. So some of those are kind of more process-based data metrics. So focusing on the processes of the ratio of your staff, your reentry planning, the intake time from intake to treatment, but also kind of outcome data. So, connection to care, and including time to the first appointment, and whether folks are keeping their appointments, and what supports are there to get them to their treatment appointments. And then also kind of those long-term impact data, looking at demographic characteristics to measure and monitor any racial or ethnic disparities, including disparities in types of treatment available, measuring access to treatment, and uptake of treatment and supports. And also, we've also seen a number of states, partnering with universities, which has really been key to the success of their efforts. I know one of the well-known studies is with Rhode Island and Brown University, really laying the groundwork for this field. But I don't know if you all have other thoughts to that question as well.
No, I think you covered it pretty well.
Okay. We have about 10 minutes left, so I know that we've, again, gotten a number of questions from the chat, so we're just going to continue to kind of work our way through here. We had one.
One I saw in there, Kaylin, was when implementation of MOUD in correctional settings has been successful, was it done in a piecemeal approach or statewide? And I think the answer to that is that it's really not a one-size-fits-all model. It just depends on, again, what's available in the community and, the different characteristics of the state geographically. Your northeastern states, many of them implemented all at once, but they don't take up a large area. There's not a number of rural settings. It's not the same space as the size of Texas or California. So it's really just depends. And if you're just kind of trying to dip your toes, it's probably best to start with those pilot sites and make sure that you're ready and comfortable for expansion there. I don't know if anybody else has any thoughts on that.
No, I think that's a great point. That's a really great question. Those pilots have, as you mentioned, been a great way to kind of get started and see what's working, and then what you need to scale up your efforts.
I also would like to add to that it's really critical in a correctional facility that your wardens and your executive staff are on board when you do those pilot programs, because when you look at a correctional facility, and the staff, it is critical that security is on board with as part of the multidisciplinary service team. So starting out in a state with a pilot and showing the other folks in the states, the other facilities, the other wardens, the other facilities, that this can work and this is effective. So to implement it statewide is probably right off the bat is probably not a good idea. But to really reinforce, like Mike said, those pilot programs, start off small and build it out, and looking into the community, what type of resources are available to support that for when these people re-enter back to the community. Because what we want to do is keep continuity from the time we have them, whether it's in a jail, a rural jail, or whether it's a prison in the middle of nowhere. And we have a lot of prisons that are built where there's not big, urban cities. So those are critical. Those are critical things. And to look at that and to communicate and to educate, once again, all of the stakeholders involved.
That's a great point, Betty. Another question we got is this roadmap focused exclusively towards state level corrections, or does it also address local, county level jail systems? We may have touched on this a bit, but while the main audience is senior state officials, we do discuss ways that states can support local and county level jail systems, and have highlighted ways that a number of states have really engaged local facilities and local partners to really kind of make it a statewide effort.
Yes, and a lot of states house some of their, their population in local jails. So we want to keep that, whether, it's if it's in a state system that they're getting, they're getting treatment, that we keep that continuity going in a local detention. So those are things to consider also.
Yeah, just to build on that, I think this is a great case study of learning going both ways, where states have learned from locals in some really successful local jail efforts nationally to point to, and then vice versa, where locals can learn from state correctional efforts. And on top of that, I think the roadmap tries to point out ways, as Kaylin noted, that governor's offices and state correctional officials can support jails, such as perhaps establishing some type of TA center, technical assistance center for local jails to work off of or to support. We've seen a number of states look at that, or supporting pilot sites, making grant monies available through things like perhaps your Burn JAG Award or other state funds that allow local jail sites to establish a pilot program and show our ROI back to state legislatures that this is worth investing in and is a concept that really is bipartisan and has real public health benefits moving forward.
And I think that in the roadmap, it's demonstrated as that we showed that in a lot of our workshops, our state workshops. And the state of Louisiana comes in mind, how they work with their parishes, and many of the state inmates are in the local parishes, and that they're working on this. And so when the governor came and he discussed that at our workshop, that was that's a phenomenal exemplary practice of how state and local partnerships can work together to expand treatment.
And key to this, really, we've got Rob Morrison, our good friends at NAZADAD, on, and we want to thank them both for their partnership, but also, if you don't know NAZADAD, the National Association of State Alcohol and Drug Abuse Directors, the report does note that when states are thinking about, if your state's new to this work, we suggest who may comprise a good core team. And on page, I believe, 21 of the report references that, Rob's membership, so NAZADAD's membership, the single state agency for substance abuse planning, as well as the good folks who are the directors of the state alcohol and drug abuse work in their respective states. These are the folks that really can be helpful in supporting local efforts, local jail efforts, can also be helpful at the state correctional level, particularly on things like reentry and forming those real handoffs back into communities. So those are the types of concrete recommendations that this report is trying to point out for state policymakers moving forward. Kaylin, I'll turn back to you.
Yep, I think that we have a time for just a couple of more questions, and certainly I know that we had a number of questions here, and would love to continue the conversation. Folks should feel free to reach out, but just a couple other questions here. One, has NGA or ACA previously supported congressional pushes to remove the DEA-X waiver requirement for prescribing buprenorphine? I know governors have really made a number of asks to Congress to increase access and availability to MLUD. So we'd have to kind of go back to check on that question, but really appreciate that and the thought there. And I don't know if Betty or Mike, from your perspective.
Not that piece of it, but the first part of that question, I think, was how common is it for a facility to have a waivered practitioner able to prescribe buprenorphine? And I think that is becoming much more common. Certainly it goes back to making sure that you have a good inventory of what's in your local community, but many states have made an initiative to support their community providers and educating them and providing them with the required training hours to become waivered. And we even know of a couple of states that have done that for their correctional physicians inside the facility as well.
Yeah, and then just one final question. Someone asked how many persons with opioid use disorders were asked about what is needed in their communities regarding strategies and solutions. Is there a real solution moving forward? Then we must ask those individuals. And I think that's a good question and a great point. I think one of the things that we do try to highlight is that, you know, in the stakeholders and individuals to engage within these efforts in the states as certainly those who are most impacted by it. So the justice involved individuals and their families and communities as a part of you know, training and educating about opioid use disorder and the medications, but also, you know, what services and supports are needed. And, you know, we've seen a number of states, including on different task forces or working groups, making sure to include those communities and individuals in the fold. So it's a great question and a great point. Okay. With that, I think I'll just turn it back to Jeff and Dr. Gondos just to close us out.
Great. Thanks, Kaylin. And thanks everyone for participating in the webinar today, for your interest. Our sincere hope is that after today, that this roadmap is just not another white paper that sits on a shelf, but is one that can be a guide to start if you are beginning or if you are down the field to help improve approaches in your area in your respective state or jurisdiction as you seek to continue to assist people who are either incarcerated or returning to their communities and preparing them and providing treatment and supports for their lives back inside those communities, and in so doing, reducing overdoses, both in your jurisdiction and nationally. Our sincere thanks today, again, to ACA and CDC as our thought and implementation partners in this space. For all of the work that went into this roadmap, my sincere thanks to Kaylin Hill from my team, who was the chief author from our side, and the work yet to come. So I'll turn it over to ACA, to Betty, and then to Jessica here to close us out. Betty?
Okay, thank you. Thank you, Jeff. We want to thank you for joining us today. We appreciate you being a part of this webinar and for all your questions. And we hope that you find the roadmap a valuable tool as a guide to expand or to assist you in putting together your opioid use disorders treatment program. We don't want it to sit on the shelf and gather dust. There's a lot of good information that's in there, and we believe that it can really help you. I know we covered a lot of information in this hour, but there is so much more details in that roadmap. And we truly hope that you find it valuable for your state. Once again, if you have any questions or need any assistance, please feel free to reach out to the National Governors Association and the American Correctional Association. And I would like to thank the Mike Miskell, our Director of the Office of Correctional Health, as well as our Substance Use Disorders Committee, Dr. Maurer, Dr. Hagan, Dr. Doss, Dr. Deal, and all the staff in the Office of Correctional Health who helped make this roadmap possible. And I also, once again, would like to thank the Centers for Disease Control and Prevention and along with the National Governors Association for including ACA as a partner. I think we're a very strong partner and we are very good together. Thank you again and Godspeed.
Thanks, Betty. Jessica, your thoughts?
Thanks. Really nothing more to add. I think Jeff and Betty covered it, but just appreciate you all attending today and for your engagement, for your really fantastic and thoughtful questions, and look forward to hearing how you're able to use this roadmap in your states. And thank you again.
Thanks, Jessica. Thanks, everybody. Have a great rest of your week.
Thank you.